Hi, I'm Paul Peterson, your host for Aging Well in LA. Today we're at the Multipurpose Center run by the Jewish Family Service. This is a wonderful facility right in the heart of the Fairfax district, one of my favorite places in Los Angeles. We're here to talk about a new program that will reduce hospital readmissions so that we can save, frankly, a bunch of money. Did you know that 1 out of 5 people who are discharged from the hospital will be back in 30 days or less? Stay tuned, it's a very important show. Welcome back to Aging Well in LA. I'd like to introduce you to Vivian Sauer, who is the Chief Program Officer for the Jewish Family Services of Los Angeles. Vivian, welcome.
Thank you. It's a pleasure to be here.
Well, thank you. We have a new program to talk about today, which is the community-based continuity of care or care transitions. Tell me a little bit about the program. What are the aims of this new program?
With this new project, Jewish Family Service is really hoping to improve the quality of life of older adults in the community by making sure that they don't keep cycling back into the hospital, by avoiding those readmissions,
right.
And also by improving the quality of life, providing supportive services in a cost-effective manner.
Right. Now, I was unaware that 1 of 5 patients are readmitted to a hospital 30 days after discharge or within that time window. That costs a staggering amount of money.
Absolutely. The estimates are that over $15 billion
Billion with a B.
Billion with a B, a year is spent on Medicare avoidable readmissions, and that's obviously of great concern.
What are some of the root causes of these readmissions?
When people come back into the home without appropriate support, they often don't get back to their doctor.
Right.
They don't fill their medications. They might not understand what medications they should be taking. They might not have food in the home. They might not have enough care at home. Right. They might be isolated. They might not have a caregiver. So there's a multitude of reasons, but getting back to their doctor, filling their prescriptions, and making sure they have community support is primary. Okay, now how does the process begin? Does this start at the hospital where the patient is met for the first time by one of your people? Right, we're working very closely. We're the lead, Jewish Family Service is the lead agency with 3 area hospitals, Good Samaritan, St. Vincent's, and Olympia Medical Center. Right. We have developed a very strong and very effective relationship with the hospital. As soon as a patient over the age of 65 on Medicare is admitted to the hospital, we get notified. We send one of our staff, a Jewish Family Service coach they're called, goes into the patient's room and helps them to understand the program and to understand the benefits of the program. Right. Now, one of the things that causes a great deal of confusion is new medications. How do you pick them up? How does this fit with my other medications? This is the kind of counsel that seniors can get, correct? Right. Absolutely. That's done in the home, okay. On the first visit. Absolutely. What are you finding when your social workers go into the home? We're finding that about 25% of the patients who are discharged, and we do screen them for cognitive impairment, we're finding that about 25% of them do screen as cognitively impaired. So often the primary caregiver is a family member who may not be up to speed on the service available. Can I assume that there is support for caregivers as well? Right. Jewish Family Service social workers, when they go into the home, are very, very cognizant of the needs of the caregivers. We consider that part of our goal is to make sure that there is support. They are offered support, respite.
Respite care, very important.
Education, and they are also offered the depression intervention if they screen as depressed. It's extremely important that we take care of the caregiver.
Yes.
If the caregiver is depressed, they're not going to be able to help the patient assume a full recovery.
Right, and I think it's important for people to know this is a growing concern. This is not something that we can solve and then it goes away. This is part of the new world we're living in with this increased senior population.
Absolutely. It's also, this particular project is part of the Affordable Care Act, which is more commonly known as Obamacare.
Right.
And it's been one of the wonderful outgrowths that Jewish Family Service has been able to take advantage of, and it's allowed us to really expand our reach and the ability to provide additional services to the older adult community.
Well, there are a lot of things you can notice in a home. There might be other impairments that weren't addressed during the hospitalization. I'm thinking early onset Alzheimer's, for example, or mobility issues that the hospital didn't exactly address. So it's very important that the home visit become part of this.
The way the program works is once the patient in the hospital agrees to a home visit, one of our Jewish Family Service coaches, these are social workers who are specially trained in these specific models, one of our coaches goes into the home within 36 hours of discharge, and that's a really critical piece.
Right.
They go into the home immediately and they do a complete psychosocial assessment. They interview the caregiver as well. They take into account the needs of the caregiver, and they do understand exactly what some of the needed support issues are.
Well, that can provide an insight to an impending problem and head it off. And of course, it's the readmission that's the huge expense. And if we can do something to guard against that, it's a program money saver.
It absolutely is, and that's why the Center for Medicare and Medicaid Services designed the program. Jewish Family Service is actually the first collaborative to be funded in the city of Los Angeles. What's so exciting, we've been in operation with this project for about 6 months now, and what's so exciting is we are actually already seeing the impact of services, so that we are seeing that the patients that we are seeing through this project are not readmitting into the hospital. They are able to stay in the community. They are able to have a better quality of life. We are catching things like depression, which is a major factor in patients being readmitted. We are catching cognitive impairment, which might not have been realized or understood before. So it's been very exciting for Jewish Family Service staff to be part of this, and the hospitals are excited that their readmission rates are going down.
That's good. Well, Jewish Family Services have been doing wonderful work in the community for decades already. How about meals? How about nutrition? Is that part of this program as well?
Absolutely. Part of our program, part of what we've said we would do is provide meals for people when they are discharged from the hospital. If that's what's needed, we provide transportation for people in order to make sure they get back to their doctor for their first visit.
Yes.
And this is a 30-day program, but the goal during the first 30 days is for the Jewish Family Service coaches to reconnect, or to connect for the first time, to connect people back to the resources and the services that are available in the community.
Right, I got you. Now, they actually have kind of like a personal health report card or something that you maintain.
And this personal health record is extremely important because it's based on what the patient is telling us. It's based on what the patient is telling our Jewish Family Service staff or social workers who go in. What medications are you taking? They look at all the medications that are in the home. What other resources do you have? What services are you already connected to? What services do you need to help you stay safely in the home? One of the most important things that we're focused on is to make sure that people understand that there are services provided both by Jewish Family Service and other community service providers that can help maintain people in their residence of choice, that can help people stay out of the hospital, stay out of emergency rooms. So we're working not only with our partner hospitals, and our partner hospitals have been wonderful, we are also working with an incredibly robust group of community service providers, including the Department of Aging, the Department of Mental Health, local senior centers, the Alzheimer's Association, and all of these providers have come together in order to provide a safety net for the community and to create a community that really supports effective and cost-effective health care.
Well, the feeling of isolation that so many seniors feel, particularly if they're alone, can be very keen and lead to a depression that can almost paralyze people. What kind of help is available for those people on the edge of a serious depression?
Well, I'm really, really happy you mentioned that, because we are finding that fully 25% of the patients we're seeing who are discharged from the hospital are screening as depressed.
Wow.
Jewish Family Service has a very long history in working with older adults and older adults who are experiencing some emotional distress. Mm-hmm. And we've incorporated that as part of this program. So when one of our Jewish Family Service staff goes into the home, one of the first things they do is a depression screening. And this screening is an evidence-based screening. Evidence-based means that it's been nationally tested, it's reliable, it's been tested across the nation. And again, we are finding that upwards of 25% of the patients are screening as depressed. Now, that could be because they just got out of the hospital. That's very understandable. Right. But there are a lot of reasons for people to be depressed, and we want to make sure that people understand that depression is treatable, and that we do provide, as part of this project, Jewish Family Service staff is available, and we are providing a depression intervention.
That's a wonderful idea, because that sense of being alone, especially if you're dealing with medical issues, on top of just aging, which is intimidating enough, this is a critical component. I can see that. Vivian, we so appreciate your giving us a background on this new program, and thank you so much, and continued success for Jewish Family Services. Thank you.
Thank you. It's been a pleasure to be here.
Okay. Time now for good advice for seniors and their caregivers on Caregiver Corner with Dr. Anat Lewis.
Medications, do's and don'ts. 15 to 25% of medication usage is unnecessary or inappropriate. Approximately 800,000 preventable adverse drug events occurs each year. As we age, our body reacts differently to medication. Aging changes the way our body absorbs, metabolizes, responds to, and eliminates medication. The more medication, the more risk for complication. Why? We see multiple doctors, and at times, the individual doesn't take their medication as prescribed. So it will increase the chances of the disease progressing, complication, going to the doctor more often, and even ER visits. Some common causes of medication mistakes are due to vision impairment, where the older adult can't read what's on the prescription. So the solution is ask the pharmacist for a larger font. Another common mistake is that they can't distinguish the pill. They're used to the blue pill and now they're getting the pink pill. So make sure you read what's on the label before you take it. Another issue is the individual can't hear the instructions when they're with the doctor. So encourage your loved one to write down the instructions. Memory loss sometimes also plays a role in not taking our medications correctly, especially dementia, where the person simply forgets to take their medication, causing them to either skip their medication or taking too much of their medication, which leads to problems. So one solution would be to purchase a pill box like this, where it has all the dates on it and you can fill in their medication in the pill box. But before you do that, please make sure to consult with the pharmacist if the pills could be mixed together, if the person is taking more than one pill. because sometimes when you mix pills together, it's contraindicated. Another solution, if someone has more severe memory impairment, is to hire in-home help to help dispense the medication. Sometimes the issue is cost, where the medications are so expensive that the senior will either cut their medication, split their medication, or try to stretch it out and not take it as prescribed. So a solution to this is ask for generic, which is less expensive than brand. Another possibility is to find out from your pharmacist if they have prescriptive assistance program. If the older adult lives alone, sometimes because of social isolation, the person is less likely to comply with their medication. So call up, check in, make sure they're taking the medication. An important tip is never to share medications. Don't you give it to anyone else, and don't take medications from someone else. If you feel a medication will also help you, first consult with your doctor before using medications that belong to someone else. Other safety tips include keeping a medical notebook. When you're going to the doctor's office with your loved one, make sure you keep track of what was discussed in a medical notebook, as well as questions you may have before or after the appointment. Another important safety tip is take a look at where the medications are in the home. A lot of times we have the medications in the bedroom, in the bathroom, in a drawer, in the kitchen. Make sure all the medications are in one location. It's very important that the medication is stored in a cool and dry place. At least once a year or every 6 months, reevaluate to see if your loved one still needs to take the medication. Sometimes the medication has expired or the condition has resolved and our loved one is still taking the medication. When it's time to dispose of the medication because your loved one no longer needs the medication or the medication has expired, please don't just throw it in the trash. Make sure to contact your local fire department or speak to your pharmacist, or sometimes your local trash recycling service has a take-back program which will let you know how to dispose of the medications safely. So in closing, what you need to know as a caregiver: know your loved one's medication, communicate with your loved one, their doctor, and the pharmacist, and develop a system to better track your loved one's medication. Thank you for joining me. I will see you next time on Caregiver Corner.
We are talking about Community-Based Care Transitions Program, brand new, and I want you to meet Alea Seeger, who is a program manager. Thank you for joining us today.
Thank you for having us here today.
Well, now, you have taken on a big task to get out into the community and help people not only understand a new program, but access its many qualities.
Yeah, it is a new program. It's really exciting because while JFS has been doing work with seniors for a really long time in the community, we're able to access a different population. We're accessing a much more frail population, those that just left the hospital. Right,
and these hospitals, let me remind everyone, it's the readmission rate that is so high. 1 out of 5 elderly people on Medicare are readmitted to the hospital within 30 days. And how is this program going to reduce that number?
We've worked with the hospitals to identify what they have found to be the highest risk readmit, what the highest risk patients are, who they are, what they may be coming, suffering from. We've targeted specific diagnoses. We've also targeted people who they keep seeing coming back and they're not sure why they're coming back.
Right.
So one of the things about this program is we're taking the information that the hospitals give us and we're going into the home with that information, and we're trying to use that information to make the transition smooth and to see what's going on at home that the hospitals may not be able to pick up on when they're leaving.
Well, as we've already learned, there are a host of issues that impact seniors who may be confused. They may not understand about nutrition, but also their caregivers may not be aware of the services available.
Yeah, we actually had someone yesterday who we went to go meet with them, and I'd say about 50% of our interventions are done with caregivers.
Wow.
And one of the interesting things about it is sometimes people have no caregivers, but in this case they had 3 caregivers and everyone had different pieces of information.
Oh, boy.
So if you have 3 different people with different pieces of information and one's not available when a certain thing is occurring, which was the case for this man, he had 3 children really invested, wanted to keep him out. He only spoke Spanish, so he was completely reliant on them for understanding, but the primary caregiver was off and gone. So when there was a crisis, the 2 that had less information just would return to the hospital. And so one of the things that we try to do is bring everybody together and use this tool to basically let everyone write down the questions and think about the questions and brainstorm a plan. So instead of reacting to a crisis, they have a plan in place.
Right. Well, now sometimes readmissions can occur for perfectly mundane things. The senior may feel isolated and alone and depressed, and they need a helping hand.
Yeah, absolutely. A lot of our clients are suffering from depression, and
Sure.
one of the things that the social workers, the Jewish Family Service, do is they use a tool that Jewish Family Service uses for all seniors to assess for depression. It's a very basic tool, it's a very short-term tool, but it helps them realize, because you're dealing with the medical issues, we have the list, we're going over medications, but also are you depressed? Because if you have someone who's depressed, they may know that they need to work on something, but they may not have the energy or the ability to do it because of that depression.
Cooperation from hospitals, it seems to me, is going to be very important, because ideally you should meet this patient before they're discharged the first time.
Absolutely.
So you can begin the evaluation at that point. Now, at-home visits, sometimes they're very difficult for seniors. They feel put upon, or I don't have the energy to clean the house up, and I'm having a visitor. But you have to walk into those circumstances as well.
I think that that's one of the most challenging parts of this program for the social workers, because they don't know what they are going to walk into.
Right.
And it's also challenging for the patients that we see, because they don't know what we're expecting to walk into. So it's a really important part, and going into the home is an important part. The way that we address this with seniors is we make it clear we're not here to judge you. We're certainly not here to see if your house is clean. We don't expect to be fed, you know, because there's a lot of people who also feel that they need to host. It's a certain population.
You put out that cup of coffee.
You know,
it's understandable.
So we address that even before we go in, which is, hi, we're coming, it's on our way, we're here for you. Really, this is about you. What do you need, and how can we help you get there? And you don't need to put on a show.
Well, there are so many services available. I just thought of one now. A lot of seniors are desperately concerned about their pets.
Yes.
You know, who is watching the kitty? Are you able to help in that regard as well?
Well, so interestingly, that's one of their main goals at the hospital. What, you know, we ask, what do you want? What is important to you? Because we have we don't want people to readmit, we want people to stay safely at home, but what do you care about? And a lot of it's like, I just want to get back to Miffy, you know, who is waiting for me. My husband is here, he doesn't want to leave me. We actually did have a client, and she was so concerned about it that we helped her get it set up. There are agencies that do have free pet food, and so we do that, and we take it very seriously, because that's sometimes the most important thing in recovery.
And then, of course, people living on a fixed income, and we are talking about Medicare patients now, often we read this in the newspaper, see it on the news, they do sometimes have to make a choice between medication and food. So are you able to help them come to know that there are lots of support services that may help with medication or transportation that they can't afford?
Absolutely. When we go out and we're doing the assessment, one of the things that we say again is we're coming to provide you with resources, but we need to know what the issues are. Right. Transportation is huge.
Well, it's Los Angeles.
Yeah, right. You can't, exactly. You can't get anywhere even if you aren't on a fixed income and you have a car. So if you don't, then you really do need help. Sure. We do the initial transportation, but I would say probably in 2/3 of the cases we help people get set up with access and city ride and those sorts of things, because without the transportation they won't see the doctor, which we talked about. They won't make it to church. They won't make it to these important things that keep them connected. In terms of the medication, we work with them and have them talk to their doctor. There are limited resources to help with that kind of thing, but doctors are aware of these issues, and so they try to prescribe. And you know, I met with a doctor who's like, we know that they don't do all of them, so we've talked to them about saying, please mention to your doctor that you can only afford so much. This is part of it. Let them know, because they may not know, and then they can help you prioritize which ones you need, but they're the ones who would know what to do.
Well, yeah, the interesting component for me is that once this process starts, many evaluations can be made. Is this person safe in their home? Fall prevention is a critical factor for not returning to the hospital. Is there confusion? Is there diminished mental capacity? All of these things, a competent home visitor, social worker or not, can make an evaluation. Now, you keep track of all of this, right? There's a report card.
We do absolutely keep track of it. While our main tool is a tool that we leave with them, because these are trained social workers, they are going out looking for certain things, certain smells, piles of stuff, things that may be health hazards. We do encounter hoarding. We do make reports to Adult Protective Services if we're concerned, because one of the great things about this program is it's about the client, it's about them taking action, but it's also a very time-limited period, and this is our real, like, the home visit is pretty much the only time that the social worker's out there. So it's a very quick assessment, and it does require training, and it does require us working with other community resources to help pick up when we leave off.
Well, what do they leave behind? Are there pamphlets and materials that are left for the senior to go over and read and self-educate? We
pretty much have found that the less paperwork, the better if you're leaving stuff behind. So what we have is we have one tool, and it has it all together, and it lists off doctor's names, doctor's appointments, medication. We do a very extensive medication inventory, a place to write questions, because the thought and the hope is that they will keep using this tool and that they'll be able to keep track of this one tool and take it to the doctor when they go and keep updating it, as opposed to having a slew of papers all over.
Right. Well, and changes come so quickly to a person, and once you have that first health break, you know, that has resulted in a hospitalization, you can almost guarantee that you're going to have these steps that follow on from that. So any reassurance you can give an older person is very important. Now, what about difficulties within the family structure that's providing care? Is that an issue that you can report to the appropriate authorities if you see signs or indications of abuse, physical abuse, or financial?
We are mandated reporters, all social workers are, and so when we see something, we had a client actually earlier this week who reported that her daughter was verbally abusing her and that she was feeling afraid, and we are required to report those things. So we take that kind of thing seriously. You know, again, because it's a time-limited thing, we have very little backup information. We have to take people at their word, and there is a lot going on, and the stresses of providing care are real and big, and so we always bring in outside sources. We'll make a report. We will potentially also then refer to ongoing case management, and we also do provide services to caregivers who may be suffering from burnout.
Do you find this to be true with this population, that they don't even know that there is a multi-purpose social center just for them right in the community, that they've never even been there before?
Yes.
I'm amazed. In my family, I say, well, you know, I was visiting the multipurpose center in Hollywood. And go, what multipurpose center? I go, it's there. It's in the neighborhood.
And that's the beauty of this model, is it's so basic.
Yes.
You know, you would think you drive by it every day, or your daughter drives by it every day, but to take the time in a chaotic life to actually explore and find out what it is when you're also trying to provide care, or when you're basically just trying to stay at home safely, is hard. So that's one of the most gratifying moments, is when we can say, you know what, this service actually does exist, and it's right here.
Right there.
Yeah.
Well, of course, the part I love the most is the congregate meal programs, where seniors can come together and visit and share a meal. This has been such a treat to meet you, and congratulations on the good work you're doing. I wish this program all the success.
Thank you.
Okay, thank you for
very
being
much.
our guest.
It's my pleasure, absolutely.
And thank you for joining us as well here on Aging Well in LA. See you next time.